My name is Pharmacist Henry Okolo, and this is Ask the Expert. Malaria. Everybody has their own definition for malaria, but the easiest one I will give you is that you see when mosquito bites you, and that mosquito is infected with the parasite, with Plasmodium falciparum, whatever. So let's leave all of those big names, okay? When the mosquito bites you, okay, and that mosquito is infected with a parasite, that mosquito passes a parasite into your bloodstream. So we'll say malaria is a blood infection caused by the parasite Plasmodium falciparum. I think that's the easiest way to describe malaria. And it comes down with symptoms like fever, headache, nausea, and the like. You know them. I know you know the symptoms of malaria. Now, there are two types of malaria essentially. There is the severe malaria, and then there is the uncomplicated malaria. Maybe in the future we'll talk about severe malaria, but for today we'll be dwelling more on uncomplicated malaria. Uncomplicated malaria, most times, let me just tell you this quickly. Many people think when you have 3+++, that's when you have severe malaria. Not be true. Okay? So for severe malaria, we'll talk about it very detailed in the future. But for uncomplicated malaria, whether you have 2+ malaria or 3+ malaria or 1+ malaria, it could still be uncomplicated malaria. And so that's what we'll be talking about today. P-Alaxin is a product from the Greenlife pharmaceuticals. It's an anti-malaria and it's an ACT. What do I mean by ACT? ACT means artemisinin combination therapy. And so WHO has classified treatment of malaria, the first line treatment of malaria to be used by an ACT. And so P-Alaxin is an ACT and a first line treatment for uncomplicated malaria. Please, uncomplicated malaria. Now, for variants of P-Alaxin, the interesting thing is before now, they had about 5 to 6 P-Alaxins, where you have the by 6, the by 12, and the by 15. And so you must have encountered those. So as I speak to you right now, we have just 4 variants of P-Alaxin. We have the P-Alaxin suspension for children. We have the P-Alaxin by 9, and that one is just 9 tablets. Then the P-Alaxin TS. P-Alaxin TS contains only 3 tablets. And then we have the P-Alaxin DS. This is the one that contains 6 tablets. So in the future, I would explain how we categorize this based on the weight, because P-Alaxin is based on your body weight, and it is very important we get this clearly. Very important question. And please, I'll try and slow down and explain this a little bit and make it very simple enough. So for the P-Alaxin suspension, this P-Alaxin suspension is meant for children. Children weighing less than 5 kg to 10 kg will conveniently take the P-Alaxin suspension. Now, when you weigh above 10 kg up to about 80 kg and above, the tablet covers you. And this is where the different SKUs come in, the different variants come in. So if you weigh from 11 to about 72 kg, you are supposed to take the by 9, okay? Or the P-Alaxin TS. Now, one difference between the P-Alaxin by 9 and the P-Alaxin TS, very important, okay? The P-Alaxin TS is a compressed form. When I say compressed, I mean reduced. If you're going to buy the by 9 before now, you have to take 3 tablets. But now we have compressed it to just 3 tablets. So instead of taking 3 tablets, you're now going to come and take just 1 tablet. Okay, and so that's the subtle difference between P-Alaxin by 9 and P-Alaxin TS. So I'll repeat that. If you weigh between 36 to 72 to 75 kg, you conveniently take the P-Alaxin TS. If you weigh between 11 and 72 to 75 kg, you play around the weight based on what the pharmacist will recommend, based on what the doctor will recommend for the by 9. So you can take 1 out of the 9 tablets, you can take 2 out of the 9 tablets, or 3, just based on your weight. And then for the DS, it is for those weighing above 80 kg. P-Alaxin DS for those weighing above 80 kg. If you don't know your weight, I don't know what I can tell you right now. But the easiest thing to tell you, the simplest thing, please go and know your weight. Auntie, if you don't know your weight, go and know your weight. Brother, bros, if you don't know your weight, it's very important you know your weight. And it's very easy. Climb a scale, and there you have your weight. Okay? A weighing scale. Don't go and climb a scale, or just climb weighing scale. So I'll split it into 2, okay? what to do and what not to do. What to do: take your P-Alaxin once daily for 3 days. Take it the same time every day with water. And I'm intentional when I say with water. Okay? Take it after food. Best is 2 to 3 hours after food, and you'll be very, very good. What not to do: do not take P-Alaxin with fatty meal. If you're coming from the school of thought of take this one with fatty meal, take this one with food and all that, so it does not apply to P-Alaxin. So take P-Alaxin 2 to 3 hours after food. Do not take P-Alaxin with antioxidants. I'll give you an example of what antioxidants are. You have the vitamin C, you have this multivitamin. People are usually confused when you're treating malaria, you take multivitamins. No, there'll be a drug-drug interaction with the antioxidants in that multivitamin. So you have your juice. Your juice, they contain vitamin C. And so all of this would interact with the artemisinin component. So you don't want to take your P-Alaxin with juice, with vitamin C, and the likes of multivitamins. So after you finish treating malaria, you can then take your multivitamins, okay? And then finally, blood supplements. You don't take blood supplements with anti-malaria. When you finish treating your malaria, you begin to take blood supplements. When it comes to side effect, the truth of the matter is every drug has side effect. Even water. This water that you drink, it has side effect. Because if you drink a lot of water, you'll be looking at me, you'll be drooling, you understand? And so what that means is that we are very, very intentional when we're talking about side effects of drug, because this is an expert opinion, okay? And so for every drug out there, they have a packing insert. You can even see all those side effects in the packing insert. So for P-Alaxin, the common side effects are the headaches, the vomiting, the nausea, the spikes of dizziness, and weakness. Everybody likes convenience. I like convenience. I don't know about you, but I know you like convenience. And so P-Alaxin is all about convenience. P-Alaxin is taken once daily for 3 days. That makes the drug very, very convenient and easy for you to comply. Okay? Another important characteristics of why you should take P-Alaxin. P-Alaxin had a very long prophylactic cover. Okay? Better than other ACTs. Now, what do I mean by that? If you take P-Alaxin, it can stay in your system for as much as 52 days. And we describe that as prophylactic cover. It prevents you from having another infection of malaria within that period. And so that's you saving yourself from having to treat malaria again in a short cycle. And so first and foremost, there's convenience. And because it is convenient, you can easily comply with taking that drug. Second, there is prophylactic cover. So it gives you prevention, okay? Prevention. It prevents you to have reinfection for as much as 52 days. This can vary with one patient to the other, but you have that in standard documents. This question is very, very important because some of the recurrent treatment of malaria, many school of thoughts or even academic body that begin to understand that people are treating malaria when you don't have malaria. Okay? Some people is when they dream and they see somebody in a dream or something, they just have different ways of saying I have malaria, or when you are eating too much, okay? Now, the standard way of knowing when you have malaria is to do a test, okay? So the standard way is to do a test. It could be by microscopy or it could be by RDT. So RDT, are common everywhere where you can just do a rapid diagnostic test and instantly you get your result. So the mantra is TTT, test, treat, and track. Or test, track, and treat, whichever way you want to put it. But testing is what will tell you have malaria. And so when you come back with your malaria result, you see 2+, you see 3+, it's telling you that you have a load, you have 2+ load of the parasites in your system, or you have a higher load. And so that's the best way to know that you have malaria, because malaria have similar symptoms with other infections that you have there. Some people confuse the fever of typhoid for the fever of malaria. All of these confusions, in further series, we are going to try to explain all of them and let you know exactly what you need to know concerning the best way to take care of yourself drug-wise. All that you're hearing is just the tip of the iceberg. Remember to subscribe and stay tuned. Thank you very much.